OK, so the original vision for the NHS was free healthcare for all, funded by UK taxes. But we now have a massive ageing population and the NHS is costing billions. In a moment, we're going to hear about the way the US funds its healthcare. But first, let's just have a look at what different countries spend on the ability to keep their people healthy. Basically, these figures are per head of the population. America is at the top with nearly £10,000 per person. Germany spends $4,473 per head. And then there's the UK, where we spend $3,840 per person. France spends slightly less at just over $3,700. And finally, Australia spends the least at $2,218, which I find quite surprising. When we talk about changing the way the NHS is funded, people immediately think of the private insurance system in the US. But how does that system really work? Michael Cannon is Director of Health Policy Studies at the Cato Institute in Washington and joins us now. Michael, good evening. Hi. Can you just explain to us Brits with our luxurious free at the point of contact NHS how the American system works?
So the American system is a hodgepodge of different types of socialized medicine, really. We have basically every type of socialized medicine represented here in the United States. We have a British-style NHS for veterans. We call it the Veterans Health Administration. We have a German-style system of employment-based health insurance that covers about 56% of U.S. residents. We have a Canadian-style system that covers the low-income residents in the United States. And we have something that's sort of socialized medicine that almost no other country has, which is a highly centralized program that administers healthcare for the entire elderly population in the United States. We call that the Medicare program. And with all these different types of socialized medicine in the United States, we don't really have a market-based system. We may call some of the health insurance here private, but it's not really private if the government is compelling you to enroll in a health plan that your employer offers, for example. And so when you look at the share of health spending that government controls in the UK, the OECD says government controls about 79% of health spending in the UK. In the United States, the OECD says government controls 83%. So that right there should give you an indication that what we have is not a market system in the United States. It is a heavily government-dominated system. It's just that the government makes different decisions with the powers that it has. For example, it steps on the gas when it comes to spending, and that's why the United States, or one of the reasons why the United States outspends all other advanced nations on healthcare. It's because government requires it to do so.
You also have, I believe, a lot of people who find themselves bankrupt when life introduces the misfortune, perhaps, to undergo some sort of illness or accident, which means that they cannot afford their care. That, to us as Brits, is still quite a shocking state of affairs. How common is that, Michael, for people to genuinely find themselves in financial hardship because they get unwell?
So I guarantee you, I've been listening to the show, and I guarantee you that my criticisms of the U.S. healthcare sector are much greater than anyone else on this program. And that is one of them, is that people too often have to file bankruptcy because of the high prices that healthcare providers charge here in the United States. Over My Shoulder is a book that the Cato Institute published about exactly that problem. And it turns out that the reason for those high and rising excessive prices is, again, not market forces. It's because of all the things that government does to raise the price of healthcare, to step on the gas when it comes to health spending and higher prices that leaves a lot of people in the lurch if they don't have health insurance, or even if they do have health insurance, because there are a lot of people who have found that their health insurance does not cover the excessive and in some cases unconscionably high prices that healthcare providers charge in this country.
Just to give us an idea, do you know, Michael, kind of what a person would pay to, say, maybe see our equivalent of a GP, just a general doctor's appointment? What will that cost them on their private health insurance?
one of the most frustrating things about the U.S. health sector is how opaque those prices are. It can cost anywhere from $0 out of pocket if you have insurance that covers everything. The U.S. Medicaid program provides first dollar coverage, and some private, so-called private health insurance plans do that as well. Many elderly Americans have Medicare and then purchase supplemental insurance so that they don't have to pay anything when they go to the doctor. Or you could have some sort of form of copayment. Or if you're a cash paying customer and you want to find out how much it costs just to have a primary care visit, oftentimes the doctors cannot or will not tell you in advance because they don't even know, and they're engaged in this very costly game of trying to get the highest prices they possibly can out of insurance companies, and because that's where their money is coming from primarily, and they are therefore not transparent about the prices that they charge to patients. So the answer to how much a patient could pay out of pocket for a doctor's visit could range from $0 to a few $100s.
Well, thank you very much. It's always illuminating to hear how the American system works for us here. Michael Cannon, their Director of Health Policy Studies at the Cato Institute in Washington.